If you've had weight loss surgery, such as a gastric sleeve or a gastric bypass or another procedure, and you have stalled for a while or you're regaining weight, you might be wondering, can you take medication to help? I've seen some people in social media groups ask why anybody would even think about or need to take weight loss medication after they've had bariatric surgery. I'm going to give you some insight. My name is Sean. I had a mini gastric bypass in 2022. I've lost 140 pounds, or 88% of my excess weight. I'm a health journalist and I've worked for an online weight care clinic. I'm now independent, so I'm not advocating or promoting anyone, but I'm going to just give you some insight so that way you can have some idea of how to explore whether or not you should take medication after having weight loss surgery. All right, so the big question is, why would anybody need to take weight loss medication after having such a powerful treatment after surgery? The thing is that obesity is a chronic disease. A lot of people who have had bariatric surgery and then they regain, they tend to think that it's their fault and they start to blame themselves or feel like they did something wrong, and they really feel a lot of shame, and they might feel like they don't have any other options because surgery is so powerful, and a lot of people see surgery as like the ultimate treatment for obesity. And that's not true. Number one, it's not your fault. Obesity is a chronic disease. It is both progressive and relapsing. So a lot of times when people lose weight, obesity will cause what's called metabolic adaptation. And that is that it will change your hormones. It will change, like it'll change your appetite hormones. It will change your brain chemistry. It will change your metabolism in order to try to get your body to regain the weight. So if you regain weight after having surgery, it's not your fault. And it's not that the surgery failed. Surgery is still the most powerful treatment for obesity. Medications are really good, and there are some medications in the pipeline that eventually may become as powerful as surgery. And the medications that we have now are amazing. Like, this is not your mom's appetite suppressant. Like, these are truly amazing medications, and we live in an amazing time to be able to even have access to this kind of medical technology and pharmacology that's so powerful and is helping so many people in so many different ways. But sometimes surgery doesn't address everything the medication can address. And so that's why some people need medication after they have weight loss surgery. There are actually times when weight loss medication can be prescribed to people who are either getting ready to have surgery or have had surgery. So for example, if you have a medical condition that one of these medications is FDA approved to treat, such as sleep apnea or kidney disease or heart disease or type 2 diabetes, then that is an appropriate use of prescribing one of these medications to someone who is planning to have bariatric surgery. There are other medications that are not GLP-1s. There are generic medications and some brand name medications that are not GLP-1s that can be used for short term to help people lose weight if they're planning to have surgery and they've been asked to lose weight before they have surgery to make the surgery safer, and they're having trouble losing that weight. So the GLP-1s are typically meant to be used long term or for life. They address the fact that sometimes some people who have obesity are missing a particular hormone, like their body is not making enough of the hormone or the brain is not very sensitive to the hormone. And so GLP-1s like Wegovy and Ozempic, or GLP-1s GIPs, which are Mounjaro and Zepbound, those are synthetic versions of hormones that our bodies are supposed to make. And so if you lose weight on one of those medications, you probably need to take it long term because your body's not just going to start making those hormones. But then there are other weight loss medications that can be used that are not GLP-1s that can help people lose weight before they have bariatric surgery. So that's an appropriate use of weight loss medication. And then there are people who, like, the disease is complex enough that they need both surgery and medication. I actually worked with an obesity medicine physician. So this is what was my case. I had so many coexisting conditions that my obesity medicine specialist, even before I had weight loss surgery, advised me to plan on taking GLP-1 3 months after I had my surgery. It ended up being 5 months because at the time there was a shortage, but I started GLP-1 and I'd planned to even before I had surgery. So there are times when that kind of treatment is necessary. The way to think about it is when you think about some people that have heart disease, some people might need a heart bypass and then they still need to take statins or beta blockers or some other types of heart medication to help manage their heart disease. There are people who have cancer that need to have surgery to extract the tumor and then may need some kind of chemotherapy to finish their treatment. So there are times when medication and surgery work together to help treat somebody. And so that's the way that I think about it with weight loss medication. Sometimes people need bariatric surgery and some type of weight loss medication going forward to help manage the disease or coexisting conditions. So that is why some people need weight loss medication after they've had bariatric surgery. So if that's you, what do you do? Again, don't blame yourself. This is a very complex disease. It's a very complex disease. It has multiple factors. The best thing to do is, number one, journal what's going on. So, keep a food diary. And this isn't really to police yourself. It's really just to kind of give your care provider an idea of what you're eating on a regular basis. So you need to keep it as, usual as possible, whatever that is. But keep a food diary so that way they can kind of look at what's been going on with your diet. Keep a fitness diary so that way they can see what kind of activity you're doing. Note any things that you notice, like if you feel like you're never full, or if you feel like you have constant cravings, or like if you eat and you still feel like you're hungry. Like all of those things are important that can help an obesity medicine specialist or an endocrinologist diagnose what's going on. And so keep those journals. If food is just like a constant thought and you just can't stop thinking about food, write that down and include that in your journal. So that's the first step. Then go find an obesity medicine specialist or an endocrinologist, or go back to your surgeon. Their surgery center might have all of these, like I have a great team that can help address obesity in different ways and offer multiple treatments to help. So go back to a medical professional who understands obesity. Go back to them and show them what you've been eating, what your activity has been like, what you've been noticing, and come up with a treatment plan to address what you've been experiencing. Then understand that obesity, there's no cure. So even after we have surgery, you need to have ongoing medical care. Like you need to have some monitoring, go in every couple of months. We already go in every 6 months for a blood test, at least I do. And that's my understanding of what bariatric patients need to do. But go in and have just like regular monitoring. So that way they can monitor your weight and your body composition. And that way, if anything comes up, if your body changes, then they can pinpoint it and help offer a different treatment plan or help modify what you're doing. So I hope that this helps answer some questions about weight loss medication after having bariatric surgery and even before having bariatric surgery. Don't feel ashamed to ask for help. This is a medical condition. It's a chronic disease and you deserve medical care. And don't feel like that surgery is the ultimate solution and that, if you gain weight after surgery, well, there's nothing left for you. No, that's not true. There's other care available. So don't deny yourself the help that you need. So I hope that helps. If you are thinking about weight loss surgery, I have 2 tools that can help you as you're planning your path to having weight loss surgery. Number one, I have a website called the Bariatric Surgery Explorer. You'll find the link in the video notes. That has 2 tools. It has a surgery procedure comparison tool So you can kind of look at different procedures and learn more about them, like what's the difference between a sleeve and a bypass. You can read all about those kinds of procedures, the most popular procedures. And then there's a cost comparison tool. So you can compare the cost of, say, a sleeve to a bypass or other procedures. And not only can you compare costs across procedures in the United States, you can also compare costs across the United States, Mexico, and Turkey. Just keep in mind all the costs are ballpark, like every surgeon has their own pricing. So that's one thing that you can find. It's a free resource that you can use to help plan your journey. The other thing is that I offer peer support calls. Now, I'm not a medical professional. I'm not a nutritionist. I'm not a therapist. What I do is I help people plan all the other stuff. It helps you save time and maybe even help you save money. I help you, like if you're trying to find a surgeon, or if and you want to know where to look, or you're thinking about medical tourism, or you're worried that your insurance is going to deny you. What do you do next? We can talk about that. So if you look in the video notes, I have a link to my Calendly. You can find some time that works for you. Let me know what you would like to focus the call on. We'll spend 1 hour together. And after the call, I'll send you a recap, and I'll also send you some resources. So if you're interested and you feel like that will help you, go ahead and find that Calendly link. Thank you so much for watching, and I wish you all the best on your weight loss journey.